Assalamualaikum and a very good morning to everyone. Thank you for joining this presentation. My name is Nurul Hasika binti Muhammad Taufik, and together with me, Ayu Dalila, Nuri Murdani, Sarah and Aina will be presenting a project completed as a part of our Six Sigma coursework titled Reducing Patient Waiting Time in a University Clinic. This project addresses a common and frustrating issue, which is long waiting time in university health clinics. Many students and staff often have to wait for extended periods before seeing a doctor. This not only impacts health outcomes but also affect class attendance, productivity, and overall satisfaction with healthcare services. Our project supports the Sustainability Development Goal 3, which emphasizes good health and well being for all. We adopted the Six Sigma BMAIC methodology, and our focus was on the first two stages, define and measure. We wanted to investigate the real causes behind long wait times, collect data, and lay a foundation for future improvements. Now, let's go deeper into how we structured this project.
So the next part is the project charter. The project charter helps outline the key elements and direction of our work. The problem statement is straightforward, which is students and staff are facing waiting times of more than 45 minutes during peak hours. This leads to overcrowding, dissatisfaction, and stress for both patients and clinic staff. And the impact of the problem goes beyond just waiting. When wait times are too long, patients may delay care or avoid visiting altogether, which can cause health problems to worse. It also stresses clinic staff, reduces efficiency, and reflects poorly on the institution. Our goals were measurable and realistic, which are to reduce average waiting time by 30%, raise patient satisfaction scores from 60% to 85%, and increase the number of patients served daily by 20%. Our team including 5 members, each taking specific roles from data collection and stakeholder engagement to performance analysis. We also had support from a clinic supervisor and a healthcare administrator who served as our project sponsor. So here is the project scope. Okay, to keep the project manageable, we carefully define the scope. Including in our scope are the patient journey from registration to doctor's consultation, time tracking survey feedback, and staff interviews and primary care visits only. Excluded pharmacy and lab services, emergency cases or hospital referrals, financial analysis or clinical outcome data. Okay. Our focus was on simple, low-cost changes such as improving appointment scheduling, managing walk-ins, and reducing bottlenecks during peak hours. By narrowing the scope, we ensured that the project would be both practical and impactful.
Let's move on to the broader impact, starting with the society. When patients get faster access to care, equity improves. In a university setting, many students delay or avoid care due to time constraints. Reducing wait times, supporting inclusive access to health services regardless of background or academic schedule. It also supports mental well-being as students don't have to choose between attending class and attending to their health. Second, economically, the project brings many benefits. By optimizing scheduling and reducing no-shows, clinics can see more patients with the same resources. This leads to better cost efficiency. Shorter wait times may also reduce indirect costs like absenteeism from classes or part-time jobs. And in long term, Earlier treatment can reduce the risk of more expensive medical issues. Next is sustainability. Idle staff and overcrowded room consume unnecessary electricity and air conditioning, especially in healthcare environments that require constant lighting and ventilation. By reducing congestion, we also reduce waste, fewer appointment overlaps, fewer rescheduled visits, and less overbooking. Ultimately, this contributes to a more resource-efficient, low-waste clinic system.
Health and safety. From a health and safety perspective, reducing wait time makes a big difference. Crowded waiting areas are not only uncomfortable but also increase the risk of spreading infection, especially respiratory illness. Less crowding means a more relaxed environment for both staff and patients. It also reduces the chance of burnout among clinic workers, who currently deal with high volume of patients in a short time frame. Next is legal framework. On the legal side, clinics are often required to report service metrics including access to care, improving improving patient flow, and tracking data more effective support compliance with regulatory standards and enhance the clinic ability to contribute to national SDG reporting. In short, a data-driven system improves accountability and transparency. Lastly, environmental benefits are often overlooked in healthcare operations. By reducing repeat visit, rescheduling, and overuse of room and utilities, the clinic lowers its carbon footprint. Also, reduce congestion means that support resources like printing, electricity, and cooling use more responsibly, helping the university move toward more sustainable healthcare practice.
To summarize, our project identified key challenges that affect the clinic's efficiency, which is inconsistent appointment scheduling, walk-in overload during peak hours, and staff availability and timing mismatches. By using tools like SIPOC diagrams, a cause and effect matrix, and FMEA analysis, we identify the most critical issues affecting wait time and satisfaction, which is average waiting time is 45 minutes, satisfaction is 3.5 over 5, and the critical failure mode is walk-in overload, RPN of 336. Our recommendations include a digital queuing system, clearer communication with patients, and improved scheduling based on demand data. The project demonstrates how even small, low cost interventions can make a big difference. Looking forward, we recommend moving into the analyze, improve, and control phases of Six Sigma to implement and sustain these improvements. By doing so, the clinic can offer faster, fairer, and more reliable healthcare services, contributing to a healthier, more productive university community. Thank you for your time and attention.